So we're starting a little bit later than expected. So we'll probably run a little bit over, more towards sort of 2:30. Yeah, I just want to say I've been here since the morning, really enjoyed the discussion so far. I think this session comes at a really good time as well, with the responses to the challenges. I think a lot of the groundwork has been done by a lot of speakers thus far to start now discussing these sort of innovations and limitations, especially from a journalism perspective. So I just wanted to say that I'll put in a 10-minute reminder when 10 minutes of your presentation has gone, and then I'll put 15 minutes as well, just in the chat, so I don't interrupt your flow. But if you see it in the chat there, then you should get a reminder. Yeah, in terms of, so if we go to the first panelist, Jane, are you okay to go first? Are you all set up?
I am, yeah, absolutely.
Yeah, great. So I know you've already presented a little bit today as well, but do you mind introducing yourself a little bit at the start before you present?
Sure. Can you see my screen there?
Yeah, can see it.
Oh, good. I've never used PowerPoint before, so just want to make sure it's working. Hi there, I'm Jane Kirby. I'm the health editor at PA Media. I have been health editor for about 15 years. And before that, I was a general news reporter at PA. And before that, I worked on the Argus in Brighton, which is where I did my journalism training. I'll start the presentation. Is that what you want me to do?
Yeah, that'd be great.
Okay, great. Okay, so yeah, as I was just saying, I've been a health editor for about 15 years, and I can safely say that COVID is really the most dramatic and unusual story that many health and science journalists have ever covered. And I think for many of us, we've had to draw not only on our specialist reporting expertise, but we've had to become sort of the best breaking news reporters in the business as well, because things have moved that quickly. And it's fair to say before the pandemic, much of my own focus was working on NHS stories, new drug developments, the work of charities and so on. And I had a bit more time to look over embargoed reports, academic research papers, and to speak to people before getting out a story. And since the start of the year, this has been changed now really to me being much more involved in working on breaking news, which takes me back to much earlier parts of my career. And as we know, and as we've been discussing today, COVID is about personal stories of loss and people working on the front line, but it's also a huge data-driven story. And luckily for us at PA, we've been able to access quite a range of tools really to help shape our stories and to try and simplify the data for the public. And if we think really how has our knowledge changed since the start of the pandemic, I would say for us that it's grown hugely. As I was saying in one of the earlier panel discussions, in the very beginning, we were all floundering around. I think across many news organisations, we were floundering around trying to work out what the data meant. But it's, thanks to one of our brilliant data specialists, Ian Jones at PA, and our collective experience now, coupled with better quality data in some areas, it means that now we can offer better insights into what's going on. But right at the start, this was a new pandemic with the new virus, and it was difficult to capture the real meaning of the early data. And in the beginning, we had to accept figures that were given to us by the government, because that's all we had. Data on deaths and cases was quite scant. It was released haphazardly by the Department of Health, sometimes on Twitter, sometimes on email, sometimes in other formats. And for us, that as a breaking news agency, that was quite problematic, because we needed several people, poised looking for where it might pop up. And also there was no real COVID testing in March or April, so we had no idea how far community infection had spread. And it's only now we know that there may have been, 100,000 infections, new infections on the day we went into lockdown in March. And up until July, we didn't have a complete set of data for the number of coronavirus tests being carried out. For a long time, we were only getting Pillar 1 testing data, which is obviously the testing data for hospitals and those with a clinical need. And that data we knew at the time was massively underestimating community infections. So it was one sort of when widespread testing got up and running, that the data became a bit more complete, although obviously due to asymptomatic infection, we know that we're still not getting an entirely accurate picture. And so I would say that over the months, we've discovered that hindsight is a wonderful thing. So back in February, the media were reporting on Public Health England's efforts to trace the contacts of just a handful of people with COVID-19 around the country. And you may remember Steve Walsh, who was the so-called Brighton super spreader. Well, we never did get a picture of him, but we got a picture here of the pub that he'd had a drink in. And, you know, while we were focused on him, we now know that while we were focused on him, potentially hundreds of thousands of people, like these people on the tube, just going about their daily business, were actually spreading COVID around the country. So what are the key lessons that we've learned when handling the data? I would say the first one is that we've learned to deal with uncertainty. So we can say where the data's come from, report the findings quite faithfully, but we have to acknowledge the uncertainty in the data. I mean, everybody wants to be able to pin down a clear finding and cut through the noise to offer a simple statement to the public. But we've learned that while we can do this, we also have to embrace the uncertainty in the statistics, embrace the fact that the data sets contradict one another, and embrace the fact that scientists often don't agree on what they're seeing. So for example, how many deaths have there been from COVID-19 in the UK? Well, obviously it depends on which data set you use. So the government's preferred measure is the number of people who have died within 28 days of testing positive for COVID, and that's the lower line on the graph that you're seeing there. But if you go into hospital and test positive for COVID and then die, you know, die after spending 29 days on a ventilator, you're not counted in these statistics. So we know that that's not a perfect measure. And we have wider data from the ONS, which helps with this. That's the top line in the graph there. And it records deaths as those mentioned on a death certificate. And now we know that this data does include suspected deaths from COVID, but, and the ONS says about 10% of these deaths are suspected, although it believes that many of these may in fact be due to COVID. But obviously, if you're looking at those figures there, the difference between the government's number and the ONS number means that we've got a big gap. And the 28-day stat currently stands at around 60,000, I think it was yesterday, while the ONS figure is 76,000. And at PA, you know, when trying to work out what to do with these stats, we've decided that we need to just report both sets of data and, you know, try and just ensure some consistency by setting basic ground rules. So we just need to be very clear who is speaking and clear what the limitations are of the data. And then obviously when it comes to something like the R rate, you've got a weekly R rate from SAGE, which differs to the one from King's College London, and they do look at slightly different time periods and calculate the R in a different way. And we just think as a news agency, it's our duty to be upfront and transparent when this data doesn't agree. And as we've been mentioning all along today, we turn to the wonderful Science Media Centre quite often to help with this, to find us scientists who can give us their opinion on what they think the data means and provide some context to it. Now, obviously dealing with uncertainty doesn't mean we shouldn't be interrogating the data, and it doesn't mean we should accept everything at face value. For example, at PA, we quickly noted early on in the pandemic that there was a delay in when deaths were reported and when they actually happened. So early on, the Department of Health would put out a UK-wide number, but we realised that this didn't tally when you added up the individual figures for England, Wales, Scotland and Northern Ireland. And we realised that something was going on between reported deaths and when they actually happened. And we realised we didn't know what was happening day to day. And I think for us, that was a real turning point. And still, you know, for a very long time, other major news outlets were recording deaths as if they'd all happened within the last 24 hours. But for us, once we could get data on an actual date of death, we found that we could do much more analysis on those figures. So in the early days, the figures from NHS England were quite a precious leading indicator on what was actually happening in real time, rather than just the numbers from the Department of Health, which were and do actually continue to be based on when deaths are reported and not when they occurred. So the NHS England numbers enabled us to spot what we saw as a peak in deaths in the first wave on April the 8th. And then obviously we could start to see them coming down in that wave. But these figures are, and you know, they still are a good example of how so much of the data to do with COVID is constantly being revised and updated. And in this case, due to the lag of days or even weeks for all COVID deaths to be confirmed and processed. And I think this taught us an important lesson, which is to always treat COVID data as a live thing. And it's something that's always been tinkered with and potentially revised as we go along. And we still need to be, you know, really careful in our reporting even now, especially when dealing with things such as time lags. And we find that this is particularly true for data on cases. So, you know, as the volume of cases got bigger in the autumn, it started to take longer for results to come back and enter the system. And we've never had really reliable real-time data on when people are testing positive. And the headline numbers of new cases, which we cover every day and need to cover every day, and other news providers do too. It's the number of new cases reported in the last 24 hours, but obviously some of these people have tested positive days ago. And so we at PA think that, you know, the day-on-day change with this particular number doesn't actually mean very much, even though we have to report it daily. And so we've looked at rolling 7-day averages of reported cases as being a bit more of a reliable measure, really. And so if you looked at the government's coronavirus dashboard and brought up the number of cases in somewhere like Swale in Kent, which is one of the places with a current, one of the highest rates of case rates in the country, the columns in the graph would suddenly drop for the last few days. But this doesn't mean, obviously, that cases have suddenly fallen. It just means there's a long time lag, and that people who tested positive on these days haven't yet been added to the data. And it's for this reason that when we run daily lists of case rates for every local authority, we eliminate the last 4 calendar days of data because we just think it's so incomplete. And it's actually an approach that we have discussed quite carefully with Public Health England, who supply the raw data to us. And the BBC have also brought their method of calculating case rates into sync with ours so that we can ensure some sort of consistency. And, you know, for us, we feel that as long as we're being transparent in how we've calculated that data, that we are actually, you know, being fair in how we're reporting it. And a recent example of when I had to deal with uncertainty, even in the last few weeks, is the data over the Oxford University new vaccine. Now, obviously, because we work on breaking news, I had to file what we call a snap, which is a single sentence of breaking news, when the findings came in at, it was about 7 a.m. in the morning. And, you know, despite years of experience, I'll admit that the press release just completely threw me. You know, I found myself feeling confused at what the headline efficacy figure was, because it was 70.4% on there, but then it was quickly followed by a 90% figure. And I had the news desk on the phone wanting me to file. So I conservatively went for the 70% figure, but I knew there was something interesting in that 90%. So what happened was that, you know, there were a few uncomfortable hours that followed before we could speak to the Oxford researchers and ask them what that 90% meant, because the original press release didn't have a sample size and didn't really have an indication about whether it was a true finding. So it was only when we managed to speak to Oxford researchers, as facilitated by the SMC, that we could get an idea that they thought they may have found that the vaccine could be 90% effective at a certain dose. But obviously, if you're following the news closely, you'll have noticed from the coverage over the last week or so that this figure is still actually the subject of huge debate. And I think, another lesson that we've learned is just how rapidly data is politicized and how different facts can be made to fit any argument, depending on a person's view of how the pandemic is unfolding. And it's meant, that we've had to be really constantly on guard and not take all the data at face value, and to use scientists and seek a range of opinions to try and get some sense of what's going on. And when ministers have, set lofty targets on things such as testing, we've been tracking those really closely and holding people to account. And we've also learned to take quite a few of the anonymised political briefings to the media with a pinch of salt and a dose of scepticism. And I would say that the last lesson we've learned really is about how even the best data insights are no good if they can't be made relevant to the public, if they can't be easily understood. And it became apparent very early on in the pandemic that we needed to be able to visualize this data. We needed to produce graphs and charts to show everything from daily case rates to how the Pfizer vaccine works. And we want, our visuals to tell a story alongside being able to offer an explanation in words. And here are some, just some examples of some of the graphics that we've used. So there's obviously one on how the Oxford vaccine works. And then one looking at the timelines of agreements for vaccines that the UK has secured, test and trace contacts, and what the tier restrictions mean in England depending on where you live. And another one there on how the Pfizer vaccine works. And so it's obvious that we've come a long way since the start of the pandemic, but there's obviously much more to do. And Ofcom is looking at the public's consumption of COVID news through an ongoing survey. I don't know how many of you are aware of this, but their most recent survey last month found that 9 in 10 people had accessed news about COVID at least one day in the previous week. And there's a lot of faith in traditional media, and I think it was 85% of adult internet users saying that TVs, newspapers and the radio was their most used source of information about COVID. However, people were also asked for the first time last month whether they agreed with this statement. And the statement was, "I feel confident that I understand the statistics and data used to provide the number of coronavirus cases and deaths." And only 52% of people agreed with that statement. So while I think the media is doing its best to try and present a clear message, there's obviously more we can always be doing to simplify and explain. Thank you.
Thanks, Jane. Thank you for that. I'm going to go over to Ross now. Are you ready to present, Ross?
Oh, sure. Yeah, no problem. As long
Great.
as Tom's okay with that.
Yeah, how are you getting on, Tom? Are you have you got access now? Can you hear us?
Oh, yeah, I'm here. I'm absolutely here. But go ahead with Ross.
Okay, great. Okay, so Ross, are you okay to share your screen, or are you not using slides?
I think Anna's going to do it for me. Is that right?
Yeah, I'm going to do it now.
Thank you. Just like Jane, it was I was learning a new skill last night, or trying to, in terms of making a PowerPoint presentation. So fingers crossed. This is a problem actually. And when Fiona was asked the question whether journalists reporting on science and health in the last session should have some sort of science degree, I kind of wish I had some, or certainly had a week or two to sort of step outside the bubble to go and learn, because it certainly wasn't what I studied at university, and it's a long time since I was at secondary school. Anyway, so we're all learning in many ways, whether it's Zoom, PowerPoint, or about science, but hopefully there's still a benefit also in terms of having, if you like, a well-trained news journalist explaining a difficult issue to members of the general public, hopefully. So anyway, thank you very much. I'd just like to say thank you very much to Anne for the invitation. to speak here. I feel very flattered to be asked. It was a bit of a tight deadline you set me, and I know I was slightly missed your 5 o'clock deadline yesterday, but hopefully got it just in time. It's just like at the Evening Standard, we have a 10 a.m. deadline for reporters to file their stories, and an 11 a.m. deadline when the paper leaves the building. So it felt a bit like I might have missed the news editor's request, but at least I got it in time for the chief sub-editor. So off we go. So what I aim to do really is give an insight into what life is like on the Evening Standard, where essentially we have the issue of getting a paper out on the streets very quickly. For those of you not in London, the Standard's a 5-day-a-week paper. It's been around for 180 odd years. We print these days about 500,000 copies. It's gone down in the pandemic, and we'll talk about that more. But essentially, the challenge is, obviously, we know that if you get it wrong online, you can quickly amend it. But if you get it wrong in print, it's stuck till the next day or until the letters of complaint come in. So that is the purpose of what I'm going to talk about today. So first off, just a little bit about me, if we could go to the next slide. Basically, that's the outline really of what we're going to say there. You know, how do you make the right call when you don't have much time? And essentially, as Jane was saying, so much has been driven by data. And for us, probably the key things often are the ONS data on a Tuesday in terms of the mortality rates from this. And obviously we've got the various media round in the morning that's becoming an increasing factor in the way the world wakes up to this news. So essentially we'll try and discuss really how to get it right quickly, and probably more importantly, how not to get it wrong. Even if you don't get it completely right, at least don't commit an enormous howler, as we may have done in the past with other stories. But we keep trying our best. I mean, next slide, please. So a bit about me. I have been at the Evening Standard sort of on and off for nearly 20 years. And I have 2 hats, and neither of them fit perfectly, shall we say. I have 2 roles, and this was the case before the pandemic struck. I'm health editor, and a couple of years ago I was given the task of being City Hall editor as well for the paper, which is a job I did previously. I've been health editor for about 7 or 8 years now, and due to sort of internal changes at the paper, I was asked to go back to City Hall as well and cover Sadiq. And at the time, of course, we thought there would be a mayoral election last year, and that was one of the things that was quickly affected by the pandemic, and it's delayed for next year. So basically, I'm essentially a part-time health reporter and a part-time City Hall reporter. And that's me with my kilt on there with the mayor at the Mansion House around Christmas time last year, a picture that Rory Stewart didn't like very much when he thought I was biased towards Sadiq. And that's me a month or 2 ago going up to Northwick Park Hospital in Harrow, which was the hospital at the epicentre of the first wave, not just in London, but in the whole country. Sat on the tube with the mask on, as we all have to do these days. And in addition to that, there's still this slightly chaotic thing we'll talk about later, that because there's never enough staff to do all the tasks and news breaks, suddenly you can be asked to do stories unexpectedly. And a couple of Fridays ago, because they'd made a bit of a mess of the rota, we had no crime correspondents in, and unfortunately that was the same day the Yorkshire Ripper died, so I became crime correspondent for the morning as well as COVID correspondent. So there we go. Next slide, please. So the challenges really are reporting at speed. As you say, the main deadline for us is 10 a.m. as reporters, and we have 1 more hour to get the paper out of the building and off to the printers. But we also have the challenge of not just reporting what's being said, but trying to find stories in the gap between the nationals going to press and ourselves going to press. So this has always been the challenge on the Standard, and especially in science and health, where so many journals publish their news with a midnight embargo to suit the nationals, really. We try not to report news that's already in the nationals unless it kicks forward to a big degree. We try and find something new and fresh, and it really is quite a challenge in this pandemic. It's certainly, without doubt, the most challenging story of our careers, although thinking back, I remember just before the London Olympics happened, and I did think, how on earth can we cover something as enormous as the Olympics? In essence, the news editor at the time said, well, journalism really isn't rocket science. Think about the people, and absolutely that was the way to do it. I don't think it's the same here. I think it's much more about data. And just thinking back what Jane said as well about the deaths and the people who have died from this, I think this has been the untold story really of the second wave, that we actually don't know many of the people who have died in the second wave, whereas in the first wave, there were frequent tributes to people dying, especially NHS staff. Almost it's unknown who's been dying in the second wave. We don't know these families. Once or twice they might pop up in the 10 o'clock news, but we've had barely any sort of tributes or personal stories this time around, which is a bit of a puzzle. So as that last point says, we basically have a matter of minutes to not just get the data, find out where it's published, it's trying to interpret it too. Next slide, please. So here's a basic sort of run through of my day, and this is typical for most of the sort of senior reporters on the Evening Standard. We have since moved to a sort of web first design, and I'll talk about that in a minute, but largely the newsroom is divided in two between the old hacks, if you like, people like me, the ones who've been around for a few years, who essentially write for the newspaper, and the younger whiz kids who are working on the website. And this is how the day goes for me, roughly sort of 6:30, try and clock on, log on, and then obviously it's just a quick check on what's been happening since I've logged off at 11 o'clock the night before, check what's on the BBC New website, try and catch the 7 AM headlines on the today programme. And then what's obviously been happening the last week or two is there can be a 7 AM breaking story where basically you've got an email that's landed 3 minutes before, whether it's Oxford or Pfizer, and then basically the web is desperate to get that up too. So quite often in between trying to let the newspaper news editor what's happening in your patch in time for his news conference at 8 o'clock, you've got to try and rattle out as quickly as you can something for the website, because basically what the web team have found is that if you don't get stuff up quickly, at least the first few paragraphs, you'll never catch the traffic if you're not first. So then basically 7:30 is the key deadline. Next, you've got to give a list of stories to the news editor. One of the great benefits I found recently is the not just the PA schedule and so on, but also the email we get daily. I'm just trying to, I've completely forgotten the name of it. This is the sort of an email that comes out each day from one of the sort of political online teams that gives a really good run through. It'll come to me in a minute, which is obviously worth checking. That also gives a list of who's on which programmes. It will often say who's on Kay Burley on Sky, who's on Today, and very often that person can often lead the political coverage of the story, such as Today with Alok Sharma, whoever's doing the media round. Another key thing, of course, is to try and work out what my colleagues are doing. And this is one of the trickiest things with us all working from home, apart from one or two news editors and the editor actually being in the office in Kensington. What you don't want to do, and unfortunately it did actually happen this morning, is essentially write the same story. So Nick Cecil, our deputy political editor, and I both pretty much wrote a story about the latest COVID stats in terms of how many Londoners have it. I used the test and trace statistics from yesterday, and he used the COVID dashboard from last night. Which is a bit of a waste of both of our times, but sadly things like that happen. By about 8:30, the news editor will generally come back on. He will then have spoken to the editor and the sort of senior staff. They'll have made a decision what they want for the newspaper, and then you basically get typing as fast as you can and try and file by 10 o'clock. And quite often, if you're writing the splash or a story of significant interest to the editor, there can be questions from the news desk or the editor herself right up until 11 AM until essentially they press the button and the front page goes to the printers. Next slide, please. So here's one we made earlier. I've got a few of these in sort of Blue Peter theme. This was a couple of days ago. And here actually, this is quite interesting, I think, because this captured both the news about Pfizer getting MHRA approval, but also the fact that the country had come out of the second lockdown. So basically, Londoners and elsewhere were free to go shopping again and so on. And my own view when I saw that at first was, well, that picture certainly doesn't really tell you the story about the excitement of the vaccine being approved. So I wonder if we've actually misjudged that. I don't have any say in the headlines, the design of the paper, although I can write my own headlines online. So that's how they chose to do it. And I think that's a reflection of the editor's interest, not just in coronavirus, but in particular in the economic impacts of coronavirus. And we see this in some of the other newspapers as well, especially the Telegraph.
Ross, I just wanted to give you a 5-minute heads up there.
Oh, right. Okay, I'm rattling on too much. I shall try and zip through the rest. Could we have the next slide, please?
Great, thank you.
So that's a little bit about the Evening Standard. So we've gone down from about 900,000 copies a day to 500,000. If you've been anywhere near central London, you'll see how quiet it is. And what we do, and certainly did at the start, is hand deliver to people's houses the paper to try and get it going. So I think it was seen certainly by George Osborne, who was our editor at the start of the pandemic, a great achievement to keep the paper going. There was a very real risk the paper wouldn't have survived. They kept it going, and we're still going so far anyway. So hopefully with light at the end of the tunnel, we can survive. Next slide, please. We've moved to Web first. So basically this is essentially added an extra level of pressure onto the reporters, onto the newspaper reporters, that basically once 11 o'clock passes, then you're expected to file for the Web should there be breaking stories, you know, and such as the ONS, Public Health England data that comes out later in the afternoon, we'll become used to. But it does present the challenge as well of trying to find fresh stories to put on your list for the next day. The next slide, please. So again, that's another example of what we're doing. This is the Oxford announcement a couple of weeks ago. And again, it was just trying to kick it forward from the 7 AM announcement to actually what does this mean? So rather than, you know, by the time people would be seeing the paper, which is normally on the streets around 3 o'clock, the idea is that, okay, you might have probably found out that the Oxford vaccine seems to work. When can you get your hands on it? Next slide, please. These are the data drops, if you like, that we'll all be familiar with. Generally, we've found that the ones that happen sort of outside our time have become less and less interest unless we can draw London data from them for the next day, which is what happened with Test and Trace today. I think Test and Trace has become less interesting each week as we've gone on. Next slide, please. So this is one actually, again, talking about what Jane was saying before, when it suddenly became apparent that what the ONS was reporting and what the government reporting was a considerable mismatch. And I think that's how we reported it at the time. And there's actually an example of a patient as well. Again, there was the case that how long were these people taking to come out of hospital? There were amazing success stories. And this was one of my big arguments with Public Health England at the start, that they completely failed to tell us how many people were surviving. And it took NHS England a long time to tell us that. We were only finding out how many were dying. And I think that's a real failing of the authorities and the data, certainly at the start. Next slide, please. So this was an example here where caution was the watchword. And the story down the side of the front on the right-hand side, 1 million Londoners have had coronavirus. That was derived, I think, from the ONS. And I thought that was a much more important story. But again, it was such a shocking number. And that just shows how perhaps we become fatigued by COVID at that stage, and we decided that the A-level results were more important. Next slide, please. So what have we learned, really? I think it's the fact that we've really learned that to be on our guard with lots of the data, and we've learned better that the dashboard especially doesn't tell you everything. And I've found this out mainly from speaking to clinicians in hospitals. And one of the main things that really is about the number of ventilated beds. It really doesn't give a sense of how many people are in ICU. And also the fact that if you speak to the critical care doctors, there are many patients in ICU who don't have COVID, but it doesn't mean they're not busy. And I know there was a figure given last week by Chris Hobson of NHS providers, basically saying that 85% capacity is the new 95%. So I think we need to be on the side of the hospitals here in terms of understanding how much pressure they're under, and the fact that the statistics don't really tell us that. The next slide, please. how do we learn? Well, I'm always trying to learn from my mistakes, try and watch others. And again, a big thank you again to the Science Media Centre, which has been absolutely invaluable. I wrote this before I realised Tom was on here, but I think his reporting has been exemplary and has really helped me understand the wider significance of the science, which has been really useful. And just, I think basically you just keep looking back and you keep trying getting better. Next slide, please. Much of what I've said there, just like just watch what the others do. There's so many brilliant journalists out there. I don't even pretend to be one of them. But the final point you'll see coming up, I think, next, just in terms of Nick Robinson gave me an idea of how to tell a story, because quite often it's not just the data, but it's how the story can be told. So if we flick on to the next slide, hopefully we should have a front page, which was about Oxford. And basically that was the way Nick Robinson described it in his interview on the Today programme. I thought, oh, that's the way to tell it. That's the way to tell it. And on we go. So if we go to the next slide again, I'm probably going to call a halt here. Basically, what do we do next? A key thing is what the editor wants, and she's very concerned about the economic impact of this on London, and London being a ghost town. So I think there's caution in how we report the bad news, and we've got to not talk down the city and talk ourselves out of a job if we're not careful. Keep an eye on what the readers want. You know, I remember being told a long time ago by one of my first news editors that, you know, remember, Ross, we're all in the entertainment industry. And I think that's never true, or even though it's a horrific story to cover, but there is reader fatigue. And just to sort of leave you here, I won't go right through all these slides, but as one illustration, what we can see now with the web traffic is that yesterday, the main or the best read story on the Evening Standard website was that of the vaccine arriving in the UK. The second best story was one that had written on cycle lanes in Kensington High Street, Sadiq Khan threatening to take over the road from the council. But the third best was one, and this actually had more clicks than the others, but less dwell time, was the fact that a politician named Adolf Hitler had been elected in Namibia, and underestimate the capacity to click on stories that are quirky, not important. Time, but thank you very much for listening.
Great, thank you for that, Ross. If yeah, there we go. Stop sharing the screen. And Tom, do you have slides to share, and can you share them?
Yeah. Let's see. Share. That is sharing. Oh, that's weird. It's now sharing a sort of nested view of my Zoom screen. So we're going to infinity into the distance. I think Anne has a copy of my.
Okay, let me open it and I'll run it from here. Okay.
Okay, great. And maybe whilst Anne opens that, Tom, could you introduce yourself a little bit for people who don't know you?
Great. So I am the science editor at the Times, and thank you very much, Ross, for those kind words. I've been writing a lot about coronavirus. I mean, I guess I'm really the coronavirus correspondent of the Times. Yes, so I started up writing about this obviously back in January. I think I was I might have been the first person in Britain to ask a serious scientist why we're bothering with this when we don't bother about writing about the flu. So I've been asking stupid questions of scientists since the beginning. And this is, I put this is in the magazine tomorrow, so I sort of couldn't resist. You're seeing me in my normal home working attire of in fact that went up, and a lot of scientists said that we shouldn't be holding dry ice like that, and we're an absolute disgrace. And risking injury. But anyway, so I'm going to talk about numbers. Just a little bit of background. I studied maths at university, so I hopefully know a bit about numbers, but on the other hand, I'm now a journalist, so you can tell how well I did at maths at university. So when I realized that this was a little bit different, so the journalist might sympathize with this. When I think of news editors, I generally group them into two kinds of categories. The first category is those who've been crushed by the job. They're these sort of pitiable wraith-like creatures who skulk in the shadows, their fight for their souls long gone. They're the good ones because they used to have humanity. The other ones are the sort who would give you a wedgie and steal your lunch money. So I say this because, to make the point, that they're not necessarily going to sit there and be really interested in Bayesian SIR models of infectiousness and epidemiology. And so this is why I found this so extraordinary, because actually my lovely editors, who aren't necessarily neither soulless nor bullies, have been. I remember the day when I felt this all changed. It was that week when we were all talking about herd immunity. And one of the editors, we were still in the office, one of the editors shouted across the room to me and said, you know, what's all this about? And I sat down and prepared to explain disease epidemiology and prepared for him to tell me to go away quite quickly. But sort of started on R and went through R, and he was still listening. And then we went on to herd immunity and he was still listening. And then went on to disease epidemiology and models, and he was still listening. And this was extraordinary, because his job, it was to decide what the public were interested in. And the public up until this point, quite understandably, have not been interested in this stuff. But then we started to notice the stats, and the public were extremely interested in this, extremely curious in this. They weren't just wanting to read, you know, in this sort of parody of the public of, you know, celebrities and sex or whatever. There was a massive appetite to understand in a sort of calm way what was going on, and it was brilliant. And that's when I realized that the pandemic had changed everything. And obviously I over-egged on the editors in case any of them are watching. But my point is, we have discovered that we've got an audience for a completely different kind of news. And sometimes it's been hardcore virology, which has been a real pleasure to find out about. But far more than that, it's been numbers. The interesting thing I think about the pandemic is that it is a story about the collective. Pandemics only make sense because there are lots of people involved, because there are populations, and because there are multiples, which means that it is a story about data. But this has also made it hard. Can we ping to the next slide? So we've all got really familiar with graphs like this. If we sort of imagine right at the far left of this graph when it was starting, so this is a graph in COVID cases per million people. Now, right at the start, what's the best way to describe how well or how badly a country is doing? Well, now it's clear that COVID cases per million people is a really good way of doing it. But at the beginning of it, it wasn't at all. We were talking about an outbreak in China. In one part of China, the COVID cases per million people were completely irrelevant because they were absolutely tiny. Later on, we were talking about an outbreak in Italy. And again, it was the north of Italy. It was the geographical entity that they happened to be grouped in was almost irrelevant to their the actual severity of the outbreak. And I found it interesting. So we started just putting absolute numbers, and then readers started complaining quite reasonably. They said, don't you understand what's going on? Don't you understand this is numbers per? And of course, that's the difference between something that's an outbreak and something going epidemic. And that's when I began to think more carefully about numbers and realized that there isn't a perfect number. We've had a sort of game throughout this that think we can find the perfect number to describe coronavirus, and we haven't. And a really good way of describing that is if we go to the next slide, excess deaths. So we've had this thing quite recently that each country records deaths completely differently, and it's almost impossible to compare between them. Jane was talking about this difference between the, how you record the deaths, and eventually concluding you just have to put both numbers, which is reasonable. But we decided that for country comparisons, excess deaths was the best, and it makes a lot of sense. You're just looking above the average, you see how they do. And then this report from the ONS came out, and we this is Europe by excess deaths, and we started plotting the figures to compare which countries had done the worst. I mean, there was no prizes for guessing which country had done the worst, but there was this amazing anomaly. If you look on the right-hand side in the middle, there's France. France, in its first wave, had 30,000 COVID deaths. You can see that. You can see the light blue line going up. That represents 30,000 COVID deaths. It had 0 excess deaths. According to this data, it hadn't had a pandemic. So if you were in France, excess deaths would be completely useless. And what happened actually is you can see it in every single country. They were tracking well below that dotted line that is excess deaths. And so actually we should have all been expecting a far better year than normal. We've had a far worse year. And of course that makes England, Wales, and Scotland's data considerably worse, because our excess deaths don't necessarily translate to the deaths above what would have been expected for the year. If you see the line up until April, we're way down, as with France. France just happened to perfectly sort of place their pandemic in the first wave so they hit zero. They have now had the same number of deaths in the second wave, so they're going to be well above their excess deaths. And so if we go to the next slide, this is the issue. Some of our biggest mistakes have been an over-reliance on a naive interpretation of numbers. And few things show it better than the daily case data. What you're looking at here is a comparison of the first and second waves. And you can see that the first wave was nothing happened, basically, according to the case data. And of course, that shows that we just weren't testing at all. And we've got our newsletters have got quite savvy about this and are aware of this, but we've all got to learn this, you know, that the tempting comparison at the end of September to say we now have more cases than we've ever had was so manifestly wrong that we learned to avoid it. But equally, if you look at the variation, I still haven't got to the bottom of why those dips, those regular weekly dips that you see on the right-hand side, all come from Tuesdays, and I'm still really not sure why positivity changes on Tuesdays to that extent. There's some lagged weekend effect I don't understand, but we've also had to learn don't trust the daily data, that there are better ones, but the better ones we've had to learn are not the best ones. So if you go to the next slide, this is the React, which is a fantastic thing. Where there's sort of the week or monthly swabs of 100,000 odd people. So you're doing a representative sample, but equally, if you look in August, you're looking at amongst 100,000 people, sort of 50 cases. The uncertainty in this data is massive. One day in July, I remember I called into the news desk to say that our website needed to be rapidly updated, because our top 3 stories on the homepage, the lead story was about localized lockdowns due to mass testing showing spikes. The second story was that about the ONS saying that cases were plateauing. And the third story was about the R rate being below 1. So implying that cases were dropping. So we had 3 different measures of the outbreak, each showing completely different directions of travel. And I wrote an analysis for that, saying if you're not confused by the latest data on coronavirus spread, you probably don't understand it. And that was effectively just artifacts of data at very low level. Of course, now the data all goes in the same direction, and we really don't have that problem because we've got a considerably bigger problem than that. So we have, I think I wouldn't claim that our coverage has been brilliant all along. I've definitely been learning, and I've definitely made mistakes. But if you go on to our next slide, it shows the data story that I was quite proud of.
I was just going to give you 5 minutes there, Tom, just so you know.
Yeah, this was our coverage of the second wave, and we really thought about how to do it so that we could effectively compare them and give some sort of information. And if you look at the hospital admissions, what we've put is the yellow is the second wave, the blue is the first wave, and critical care. And it feels to me like a far better way of showing what we're truly dealing with, and showing that it's a lot less, and showing that the challenges are different, not trying to downplay it. But I think this was when we really began to get wise to all of the different ways in which numbers can work. But like Ross and Jane, and understanding that there is no such thing as a perfect number. You need all of them. You need to explain the uncertainty. And actually, the thing that I've discovered, much like our news desk, is that readers, news desks, they want uncertainty. We don't actually want these sort of simple gotchas. But for my final slide, I'd just like to talk about the limits of this. So one of the things, this was, yeah, I am indeed having a Twitter beef secondhand over a talk on this. One of the really weird and annoying things that's come out of this is in particular these conspiracy theories, but in particular the false positive stuff. I think as numbers people, we like to think that numbers will be the ultimate answer. The annoying thing about false positives is a lot of the complaints have been, they've hit the highest level of epistemological proof of being wrong. You know, they are mathematically provably incorrect. You have Desmond Swain MP saying that the false positive rate is 2.4% at the same time as the total positive rate is under 1%. So, you know, this is literally impossible. But this has persisted. And the other day, I had a conversation with someone who was perfectly polite on Twitter, and sort of who was explaining that this person was saying that they'd read a story in the Times about how 30% of positives are false. And I said, well, I wrote that story. That doesn't mean there's a false positive rate of 30%. It means that at very low prevalence, if you've got a false positive rate of 0.1%, it may be that if you pick up 0.3% of the population as being positive, 1/3 of those are false positives. And it just, and I don't mean this to be condescending, but I mean this to people who work in numbers don't realize that not everyone does. And it just didn't go in. And I think a lot of this just hasn't gone in. And so we've got our fancy graphs, and there are days when I find it really hard to understand what's going on. I think that Jane said that 50%, 52% of the public say they're happy with the coronavirus statistics. I'm not happy with my complete understanding of how these coronavirus statistics are calculated. I mean, things like, I don't know why we have this weekly cycle of Tuesdays. And so I think we have to be careful about thinking that a pretty graph will do it all. There's still room for emotion, persuasion, and listening and other modes of explaining a pandemic, because if we keep it to the numbers, then I think it becomes those things that one death is a tragedy and you know, 1 million is a statistic. So the statistics are great, but they're not the whole story.
Right.
Thank you, Tom. Thanks for all that detail as well. I think especially over the false positivity rate, I think that has become this sort of key issue that a lot of people are trying to untangle. So thanks for that. I'm going to pass over now to Paul Bradshaw as the respondent to sort of tie together some themes that emerged throughout that panel. We are aiming to finish, just so everyone knows it, at the original 25 past. If we're a couple of minutes over, that's fine. We just want to sort of make sure the conference doesn't run too late. I'll just pass you over to Paul now.
Thanks, Brendan. Yeah, and yes, I'll respond quite succinctly. I've never done this role before, responding. It's quite a weird thing. So yeah, some really interesting points there. You know, lots of talk about the difficulties with the numbers. Jane makes a really interesting point about embracing uncertainty and the idea of, you know, different measures of the same things. Scientists contradicting each other. You know, it's often been said there's no such thing as kind of scientific opinion being one thing, and I think that's something we've got used to. Tom also talked about, you know, the dangers of over-reliance on naive interpretations of numbers, and we need to be more sophisticated in the way that we understand what can and can't be said with those. And Ross likewise highlighting, as did Tom, you know, that the human side of these stories, and actually in this second wave, we haven't heard the human stories as much. It does feel like there's been a bit of reader fatigue, which again Ross mentioned, and maybe it isn't about the numbers. Maybe we're looking at maybe we should be talking more about the human side of things. Maybe we shouldn't be making this just about 1 million deaths being merely a statistic. But I'm sure we've got lots of questions in the chat, so I'll wrap it up there.
Yeah, so thanks, Paul, for that. I wanted to encourage people as well to post their questions in the Q&A. I think at the start I posted just to the panelists to ask them to pose questions, but that's to everybody. There is a question here, and actually I have a couple I'd like to ask as well if no more come through. So this one is from Milan Joshi, and it's a question for Ross. So given the difficulties with daily deaths figures, e.g. accumulation over weekends, would you aggregate them over a week and report them weekly so as to bring out any consistent trend? And I guess after Ross has sort of addressed that, if either one of the two other panelists wants to talk about that, that would be good.
Well, what we do, when there's space, because the paper's actually shrunk in pagination as well, but we try and include a sort of daily graphic showing the direction of the numbers, and including deaths, hospital admissions, ICU admissions, and so on, basically the key ones. But in terms of deaths in London in the second wave, these have been really quite small, and say around 12 to 20 a day. So these really don't form part of any news story now, but the key figure we've found is the most useful from the dashboard is the case rate per 100,000 on the 7-day rolling average. So basically both in London, and we can pinpoint any hotspot boroughs such as Havering and Redbridge in East London. So we've moved away from deaths actually, apart from massive headlines. I think the last story we did on deaths was when London reached 7,000 deaths about 10 days ago, but we don't really report deaths as a news story now.
Tom or Jane, have you got any comments on that, the sort of reporting of those daily death figures compared to maybe a roll-in weekly average?
Yeah, we've slightly struggled with it because, I mean, because of the noisiness in the data for exactly that reason, and we've tried different things, and sometimes we've done the rolling average compared to the rolling average 2 weeks ago, which is probably the best, but the rolling average isn't updated on the day. If we compare daily figures, we will normally compare to the specific daily figure 2 weeks ago. But the problem with that is you then get this, although there is the weekly pattern, you then get the impression that there were 200 deaths reported that day, which they were, but actually the rolling average that day is 400. And so it's misleading. We've taken to doing a little panel which shows graphs of those figures, so you can sort of interpret it yourself. But it's not ideal, and particularly not ideal when they suddenly sort of add on 1,500 because they made an Excel mistake or something.
Jane, how about yourself? Have you got anything to add to that? Or
yeah, just very similarly, we do report the daily deaths, but obviously there are issues with it. I mean, we're still reporting it because there is an appetite from our customers to have that daily total. But we also put out quite a lot more sort of longer term data as well, looking at, over the last 7 days and so on, to try and get more of a sense of what's going on over time. But we do report both, yeah.
Yeah, that kind of actually leads into a question that I had around, it was something that came up in both yours, Jane, and Tom as well, but also in an earlier panel from Pamela Duncan around this issue of, especially when you're talking about deaths and you have these different ways to count it. I think there seem to be these sort of maybe slightly conflicting ways to go about it, whether you post and whether you record, whether you write about all three of them. And that might mean that you end up in this slightly contradictory space where you're saying it surpassed 75,000 and then it surpassed 60,000 the next day, and it can be confusing, or whether you stick with one particular measure in order to reduce that uncertainty. But then I know from your comments, Tom, you're saying actually that uncertainty readers actually quite like being sort of treated maybe more like adults. So that uncertainty is maybe better to present to them. So I just wondered whether you could expand on those points, and Ross as well, if you've got any thoughts on that.
Me, I mean, yes, they do, but the problem is if you decide as a paper that you're going to each day have a little dashboard, which I think is a good thing to do, then you can't necessarily each day sort of explain through everything. So I don't think we've completely solved that problem. I think, like Jane, it's sort of slightly intractable.
And I think for us, the way we deal with it is, for example, the difference between the government 28 days from a positive test data and then obviously the ONS figure, which is much higher. We report both and we try to just be really clear on what the limitations are of both of them. But one thing that we've changed is, so for example, when we hit the 60,000 death figure on the government figures, I think it was yesterday, that we don't go all guns blazing on that figure. We're not sort of putting a snap out saying that we've hit 60,000. We're not making it the top of our story. We're incorporating it into our lead story, but we're not flashing it as one of the headlines. And other media have taken a different viewpoint on that, but because we realise the limitations of what that figure means, and obviously we're continuously updating with the ONS figure as well, we don't feel it's right just to keep pushing one of the figures over the others. So we tend to present both and not go crazy on either. That's what we're trying to do anyway.
We had an interesting situation about 3 or 4 weeks ago where ONS on the Tuesday started for the first time to report a UK figure. Now, I know PA did a marvellous job in adding in both the hospital deaths that not counted by ONS and also adding in the other nations apart from just England and Wales. But for the first time, ONS gave a UK death rate, but the decision was made above my head at the paper not to use the UK figure, just to use the England and Wales figure because it was felt to be a bit too scary. I'm not sure I agree entirely with that, but I think I only tend really to use death figures now in terms of individual hospital trusts. You know, for example, the other day I did a story about King's College Hospital and a documentary about long-term ICU patients, and there I would say, you know, there were 535 deaths at that trust. But I think the issue is something Tom alluded to, is we've completely lost the sense of context. You know, the amount of coverage we gave 7/7 when 52 people died, or Grenfell when it was 72, we're still talking about Grenfell, and we're now at 60,000, and it's just washing over people's heads is of enormous concern to me.
Yeah, thank you for all three respondents there. I've got one final question before we wrap up from Fiona Lethbridge. And she says, could the panelists tell us a bit more about any tussles with their political reporter colleagues? Do you have to fight to cover some stories, and do political reporters approach data and stats differently? Jane mentioned taking anonymous government briefings with a pinch of salt. Do your political colleagues do that as well?
I can answer some of that. At PA, I think we all take it with a pinch of salt, really. I feel really lucky compared to some of just a couple of colleagues on some of the nationals who really do have this fight with their political team. And I think part of that is because COVID is a front page story, and so the political teams want their name on the front of a paper, and there can be a bit of argy-bargy with the health reporters to get that spot. Obviously, because we're a news agency, it just works really differently. We're sending it out into the ether, and so there hasn't been that tension, really. I feel like we've worked really closely together. If for example, the 5 o'clock presser is mostly Boris Johnson, the political team tend to take it. If it's Matt Hancock, it's me. And you know, we discuss as we go along who's going to take what, but you know, I don't feel in any way that I wouldn't let them push me around anyway. So there's none of that going on at where we are.
Okay, thanks, Jane. Sorry, Ross and Tom, I know you might be sort of edging to get in there. In terms of time, I think we're gonna wrap up now. I just wanted the chance for everybody to give you a round of applause, either on the chat or you know, you can hear mine here. You don't get to hear that much nowadays, so there you go. And thanks, Paul, as well, for sitting as the respondent. And I'll pass you back over to Anne.
Great, thank you.
Okay, thank you very much, everybody. We take a few minutes to the break and then come back in 5 minutes for the next section.